Merci beaucoup, Christian. C'est mon tour de
Thank you very
prendre
much,
la
Christian.
responsabilité
Well, now it's my
de
turn,
cette présidence.
and I have to take over
Et
the
donc, je
chair.
vous propose maintenant
So
d'examiner
I
le
suggest
point
that we
suivant de
now
l'ordre du
move
jour,
on
qui
to
est
the
la
next
réforme de
agenda item
l'Organisation
we have
mondiale de
to
la
deal
santé
with. This is WHO
et la mise en
reform,
œuvre
implementation
qui en est faite au Bureau
at
régional de
the
l'Europe,
Regional Office for
notamment
Europe,
sur les actions de l'OMS en cas de flambée épidémique et d'urgence.
focusing in particular on WHO's
Donc
work
lundi,
in
nous avons déjà
outbreaks and
traité,
emergencies.
pour ce qui est de la réforme
Now,
de
on
l'Organisation
Monday,
mondiale de la santé,
we looked at WH reform,
la
and
question
we looked at a slightly
des
different
éléments
aspect
relatifs
of
à la
it.
gouvernance et à
At
la
that
gestion.
time, we looked at governance and
Aujourd'hui, nous nous
management.
pencherons sur l'action de l'OMS dans ce
Today,
contexte
we're
des
going to
flambées
focus
épidémiques et
on
des urgences.
WHO's work in the
Et j'ai le
context of
plaisir
outbreaks and
d'accueillir
emergencies.
le docteur Guénel Rodier,
And it's
qui est le
now a
directeur de la
pleasure for
division
me
de
to
la
welcome
préparation
Dr.
des pays en
Guénel
matière de
Rodier,
santé
Director
et
of
de
Country
règlement
Health
sanitaire
Preparedness and
international
IHR.
et qui va nous faire la
I
présentation
would like to
de ce
invite
volet
Dr.
de la
Rodier
réforme.
to present this part of
Mon cher
reform
Guénel,
to us. Guénel, you have the
le micro
floor.
est le vôtre.
Merci beaucoup, Monsieur le Président. And good morning, everyone, DG Hardy, Your Excellencies, ladies and gentlemen. We're going to go relatively rapidly through a big topic, which is this implementation of the recommendation of the review committee when it comes to the international health regulations and on WHO reform in health emergency management. In decisions, World Health Assembly 69, so only a few months ago, in May 2016, the World Health Assembly requested the Director General to develop for the consideration of the Regional Committee in 2016 a draft implementation plan for the recommendations of the Review Committee, and then to submit the final plan for considerations to the Executive Board at its next session in January 2017, and then it will go to the World Health Assembly. I have to say that this follow a number of discussion and document at the Assembly, particularly the report itself of the IHR Review Committee, and then the regular progress report and its annex on the monitoring and evaluation framework. The approach which has been taken by the Secretariat, first of all, is to consider that recommendation 1 of the Review Committee, which is to implement rather than amend the IHR, that this particular recommendation, in fact, some state parties consider that some of the recommendations may in fact require amending the IHR. Accordingly, the draft global implementation proposed, and again, it's only a draft at the moment, so it's not very detailed. It proposed modalities and approaches to immediately implement the recommendations which are in line with the approved IHR, so things we do not need to be delayed at all. And then the way forward for the recommendations which may require consultations of state parties and possibly amending the IHR. Importantly, the draft global plan includes 6 areas of actions, which is a regrouping of 12 major recommendations, the 12 major recommendations, and the 60 supporting recommendations of the review committee. So these 6 areas of actions, the first one is typically focused on countries. It's about accelerating country implementations, and I will come back on that later on the next slide. The second one is strengthening WHO capacity to implement the IHR, and that's very much actually implementing the new WHO Health Emergency Program. The third area of action is to improve the monitoring and evaluation of and reporting on core capacity under the IHR, and that refers primarily to the monitoring and evaluation framework which has been proposed as an annex to the IHR progress report at the Assembly. The fourth area of actions is to improve event management, including risk assessment and risk communications, and I will come back on that particular issues. And the number 5 and number 6 area of actions relate to, first of all, to enhancing compliance with a temporary recommendation under the IHR 2005, which is primarily about Article 43 of the IHR that needs to be implemented on, I would say probably on a proactive way more than on a passive way. And then the number 6 is the rapid sharing of scientific information, which follow in a way the PIP, but also be aware that, and I think you are all aware that there is a PIP, an ongoing PIP review committee, and the PIP review committee report will also tell us maybe which direction to take. But this area of action number 5 and number 6 certainly are the one which may and certainly require more consultations with the state parties. So the detailed mechanisms still need to be defined for the last two points and for others. But we have limited time today, and I will focus only on 3 areas. And we'll look forward to your remarks and questions and suggestions. So the first is selected recommendations talking about this area of action number 1, accelerating country implementation of the IHR. It's roughly about 4 key points. To develop a global strategic plan, again, a recommendation of the review committee. And this global strategic plan will build on this current implementation plan of the recommendations. The second one is to strengthen the national IHR focal point. We know the IHR national focal point are a unique and extremely useful network that needs to be further strengthened and bring alive, I would say. But a lot of ongoing communication between national focal points already exist. And then to prioritize support to the most vulnerable countries, that's very clear also in the new WHO health emergency program. It doesn't mean on the IHR implementation we won't support the other countries, but the priority will be given to these most vulnerable countries. And the fourth bullet here is to boost core capacity under the IHR within the health system strengthening. Very clearly, we want that to be linked to the effort on the health system, including the universal health coverage. The third area, I skipped the second area because it's very much about the implementations of the WHO health emergency program. But the third area, self-assessment, annual reporting, and the revised HR monitoring and evaluation framework. This, in a way, is to continue the mandatory self-assessment, but as requested actually in 2015 by the World Health Assembly, based on the recommendation of the previous IHR review committee, to move away, or not to move away, but not to rely only on self-assessment when it comes to assessing the capacities in countries. So that means we're going to, and we propose to introduce simulation exercises, after action review, and joint external evaluations, all these things, of course, on a voluntary basis and under WHO leadership. In these regions, when it comes to, for instance, joint external evaluations, I think it has been done in 3 countries. We have done since late February already 12 countries globally, and we have received support from a number of countries, including through this alliance that help us to move on with this and to accelerate the implementation of the joint external evaluations, again, on a voluntary basis. And the fourth area is to improving risk assessment and risk communications. Here we're dealing with the recommendation of the review committee, which was about, I think it was recommendation number 6, which was about having a standing advisory committee. We will actually propose a scientific advisory group of experts for infectious hazard that will guide WHO's work in this area and will help the Secretariat. And we also do this, as already said or done in the WHO health emergency program, to have systematic assessment of events, and the result of this assessment will be made publicly available. So overall, we have a plan, I would say, but the plan is still in a draft form. It will incorporate all the comments received from the 6 regional committees, and it will try to provide more specifics, of course, when it comes to action to be taken, to the actors to take such actions, and to the timelines to deliver what we need to deliver. It will also stress the importance of national commitment for the design of the plan itself, as part of the national health policy plan, and also the commitment for domestic funding. Many donors have expressed the importance to see all member states to actually commit to have domestic resources in that. So moving to the WHO reform, progress and implementations for the European regions. I think this slide is just to show what has happened since World Health Assembly 2016. I would just stress that in July, we had this new program design completed. We also have an executive directors on site and operational following Brussels Ward. So now we have Dr. Peter Salama. And then in September, this is typically now the review by member states, in a way, taking on board your comments. And then on the 1st of October, we will actually make this new structure totally operational, and I will shift name of my departments, which I will myself focus more on country emergency preparedness and IHR. So the principle of this WHO Health Emergency Program, I believe everybody here is familiar with all these principles, which apply to all three levels. In an all-other approach, that means we're not dealing only with the international health regulation, but with other frameworks like the Sendai frameworks. So it will be one workforce, one work plan and budget, one line of accountability, one set of processes, for instance, the grading, and one administration system. I don't need to go into details here, but maybe on the one line of accountability, just to be clear, that has been well defined now. When it comes to day-to-day management, long-standing protracted emergencies, member state preparedness, grade 1 response, this is the regional directors in charge. When it's about policy, strategy, operational planning, grade 3 emergencies, public health emergency of international concern, major protracted crisis, or the UN Interagency Standing Committee level 3 event that will be with the executive directors, and for grade 2, this will be assessed each time. But of course, the ultimate authority remains with the Director General. The strategic objectives actually reflect the structure and the organigram we have today when it comes to this new WHO Health Emergency Program. It's reflected in the 5 departments that we have today. One on health emergency information and risk assessment to ensure global alert system for early detection and risk assessment. This is typically where we do, and we have team working on epidemic intelligence, on risk assessment, on data analysis, and on monitoring the response operations. The emergency operations department also will deal with, of course, objective to reduce mortality and morbidity in health emergencies. That's where we find the team dealing with emergency management, with partnership with the GORN network, the Global Outbreak Alert and Response Network, and for instance also the interagency coordinations. The infectious hazard management to ensure prevention and control strategies and capacity for high-threat infectious hazards. That's a department where we will find, for instance, the influenza program, specialists in viral hemorrhagic fever, in the group dealing with meningitis, with vector-borne diseases, but also beyond specific area on diseases, social sciences, or for instance also stockpile management. And then the Department on Country Health Emergency Preparedness and IHR will ensure country capacities are established for all hazard health emergency risk management. Very much work to be done with the regional offices and with the country offices. And it will include the IHR Secretariat, but also a team focused on monitoring and evaluations, and one on preparedness, filling gaps with, again, the support of helping the region and the country offices. And then the last department is on emergency core services to ensure planning, financing, human resources. Typically, it will have these fast-track procedures to respond rapidly, and for instance, access to the emergency funds. And with these introductions, I thank you very much.
Merci beaucoup, Genaël.
Thank you very much, Genaël. That is, of course,
un caractère tout à
extremely
fait
important
particulier pour notre région.
and is of
Nous avons
specific
une réunion
interest for our
informelle dimanche
region. We have
après-midi
an informal
pour les
meeting
États membres
on Sunday
qui les invitent
afternoon
de
for the
manière
member
tout à fait
states
volontaire. J'ai eu le
on a
plaisir
very
d'animer
voluntary
cette
basis,
réunion
and I will
où de
have the
nombreux
pleasure
délégués étaient
to
présents
chair that,
et
meeting.
l'atmosphère était
A
extrêmement
number
positive.
of delegates
Les
were
commentaires
present, and the
étaient
comments were
plutôt
very
très en soutien de ce projet et de
supportive.
ces
The
propositions qui
atmosphere
ont
was
été
very
faites.
positive
Nous avons insisté à
on
nouveau
all
sur
these proposals.
le fait que
It was
l'évaluation
stressed
des
as well
pays,
that
ou en tout
the
cas
country
l'aide
evaluation,
qui peut
or
être
at any
attribuée
rate
pour
the assistance that
l'organisation
may
de
be
l'implémentation du
given
règlement
by the
sanitaire,
organization for the
était fondée
implementation
pour le
of
cadre d'action
IHRs
sur 4
is
composants essentiels.
based on
Bien sûr,
a framework
l'évaluation
on 4
externe
main
qui doit
areas,
garder
and
son caractère
external evaluations, of
volontaire.
course,
Le
needs to
fait
be
qu'il puisse y
continued on
avoir
a voluntary basis. There can
des
be
actions d'examen de ce qui a pu être entrepris dans les situations de crise, des exercices de simulation dont le caractère collectif est certainement très important, et bien sûr la déclaration globale des capacités. Notre comité permanent du comité régional, Madame la directrice générale, a particulièrement travaillé à cette implémentation du règlement sanitaire international pour la région Europe, et je pense que nous serons à même de continuer de vous présenter les contributions qui sont particulièrement limitées. Dans ce cadre-là, je voudrais inviter maintenant le Dr Nedret Emiroglu, qui est directrice de la division des situations d'urgence sanitaire et des maladies transmissibles, à présenter les incidences régionales. Merci, Nedret.
Thank you very much, Mr. President, Madam Director General, Regional Director, Your Excellencies, Ministers and Delegates. And in continuation to the global perspective of the new health emergencies program, I'm honored to be able to give you an update on what has been happening in the European region, as well as our priorities. As you have heard, the program is established within the spirit of one WHO with the 6-1 principles, and we are following them. And as demonstrated in this conceptual framework, we are working across the region in the overall health programs, tackling the top and down, bottom up, cross-cutting as defined here. So we are strengthening our capacity to be able to rapidly detect and respond to emergencies. One of the priority areas is supporting countries' preparedness in that aspect. And then we are committed to lead on linkages with the health systems and essential public health functions. This is an area where we have already started taking actions together with the Division of Health Systems and Public Health, which I really acknowledge their support. So as you have heard from again now, the same structure is designed across all major offices, headquarters, regional offices, in order to optimize the coordination and operation and information flow. And during this biennium, in addition to the global priorities, which are going to be health emergency information and risk assessment, core capacity assessment, monitoring, evaluation in the European region, we will also give emphasis to strengthening country preparedness, as I mentioned, linked with the health systems. In addition, of course, I'm not going to elaborate in the coming slides, but strengthening the core services will provide the whole program with integrated management support and timely and effective administrative actions, as well as with timely and transparent communication, which we believe are essential components, which will allow us to rapidly deploy the staff or access to the resources, which is going to ensure a good operation. Now, let me elaborate on the details, taking the strategic objectives presented in the previous set, particularly looking into what we are going to plan to do in the European region. As I previously mentioned, country health emergency preparedness and IHR is a priority for the region, as repeatedly requested by you. We are supporting and strengthening the member states' preparedness using an all-hazard and a whole-of-government approach and engaging all relevant sectors at all levels. In implementation of the IHR monitoring and evaluation framework, as again repeatedly requested by you, we are moving now forward with the self-assessments to joint external evaluations, which is combined with all 4 components of the framework, so the simulation exercises and after-action reviews. And under the leadership of WHO, we will continue to give priority in implementation of all these 4 components, taking it as a comprehensive package to allow transparent assessment of core capacities. And we believe these tools will guide our work with the member states to tailor the development of country-specific national plans addressing the gaps and contribute to the country capacity development. And we are committed to engage all member states and partners, taking an inclusive and transparent approach. As again, this work is already started, linking the health systems component, again looking into the gains and concrete actions which is going to ensure the sustainability. Under the health information, emergency information and risk assessment, the team will continue to operate at all times as the regional IHR contact point, continuing to screen all signals, which is about 15,000 a year, to rapidly detect and verify the public health events, again working very closely with you, member states and the partners. An area we will be strengthening is going to be the risk and needs assessment, which is harmonized also at all levels, allowing us to detect early, mitigate and avoid events coming from emergencies. Now the DG approved the new set of WHO protocols for risk assessment, grading of emergencies and instant management system, and we are applying all these to WHO offices. We have already started using them. I just want to inform you that they supersede the existing WHO protocols and they will remain in force until the new second edition of the emergency response framework is established. And as you heard during the report of the regional director, we are fully engaged in the management of 3 ongoing graded emergencies, 2 protracted emergencies, the other one is Zika, and the establishment of the instant management system, a clear command and control platform, allowing for improved coordination and communication across all levels of the organization, actually enhance our emergency operations capacity, as already experienced during the Zika virus outbreak. And moving forward in this area, we will pay a special emphasis on strengthening the partnerships within the United Nations system, but also outside, including with the civil society, for a fast and effective, predictable and comprehensible response. And in the European region, there are many important networks and partnerships that we plan to expand. I just list a few of them is the Global Outbreak and Alert and Response Network, institutions, emergency management teams, and we have already started to strengthen our collaboration. Under the infectious hazard, sorry, can we go back one? Yeah, under the infectious hazard management function, we have already started to map the high-risk pathogens most relevant to the region. That allows us to support the countries in the context or disease-specific preparedness. Of course, we will continue to provide the support to member states in addressing the pathogens which is relevant in today's highly globalized and mobile world. And we will continue to develop the prevention and control strategies, including the establishment and maintenance of expert networks like the clinical management, infection prevention and control. Now let me elaborate on how this all comes together in a structure at the regional office. As you have heard, the health emergency program in the region is fully aligned with the structure in all major offices. The program, as proposed by the regional director and approved by the Director General, is located within the Division of Health Emergencies and Communicable Diseases, capitalizing on the technical expertise we have in managing communicable diseases. This will further ensure close links within these 2 technical areas, and actually it takes into account the Europe business model of serving a large number of member states with consolidated teams that ensure effective program delivery. And I'm honored to be appointed as the Regional Emergency Director by the Director General, and I'm committed to provide the leadership and ensure one line of accountability and responsibility in the program, directly reporting to the Regional Director and the Executive Director, as you have heard, depending on the situation and the functions. In my work, I'm supported by 2 senior coordinators, respectively for health emergencies and communicable diseases, that will ensure an effective and efficient delivery of the division's work. And we are confident that this structure is going to ensure a successful implementation of the program in the region. With regards to the implementation status, now the new structure is established. We are working on the alignment of the staff now, which is going to be finalized by the 1st of October. And then the recruitment of senior key positions is going to be the priority until the end of the year. Based on the funding availability, we hope to be capacitating our division and the support to the countries. In conclusion, I would like to assure you that we are ready and fully committed to work with you to make the program a success. Thank you very much.
Merci beaucoup, Dr. Emiroglu.
Thank you very much, Dr.
Nous allons
Emiroglu.
maintenant donner la parole à l'assistance.
So now
Donc, je
I would
demande
like
aux
to open the
délégués
floor for
qui
discussion.
souhaitent prendre la parole
Request
bien
delegates
vouloir
wishing to speak
soulever
on
leur
this
plaque
item
nominative.
to
Merci beaucoup.
raise their nameplates.
Alors, je vois tout de suite
So I can
la
see
Slovaquie
Slovakia
et la Serbie.
and Serbia.
Slovakia.
Chair, I'm speaking on behalf of the European Union and its member states. We welcome the progress made in the implementation of the emergency reform. Keep up the good work and complete the phase of transition by October the 1st. We congratulate the new Executive Director and thank Bruce L. Ward for his tremendous and successful work in designing the new program. We would now appreciate to see the organizational chart of the WHO Health Emergency Program to better understand the articulation between headquarters and regional offices and the implementation of the line of authority of the new program, as well as an update on the selection of the regional emergency director. We especially appreciate the work done on grading and risk management, as well as on strengthening the relationship with partners within and outside WHO. We encourage WHO to continue its close cooperation with EU institutions and in dedicated agencies, such as the European Centre for Disease Prevention and Control. We also encourage WHO to strengthen its coordinating capacity within the health cluster and take leadership in public health emergencies. We welcome the establishment of the Global Health Task Force by the UN Secretary-General and encourage the Secretariat to inform the governing bodies on its work and on a regular basis. The EU and its member states remain deeply concerned about the acute and protracted crisis with health consequences, especially in Syrian Arab Republic, Yemen, Libya, South Sudan, but also in the Ukraine, in our own region, as well as by the outbreaks of yellow fever, Zika, and most recently polio in Nigeria. We recognize with appreciation that WHO is already able to work successfully, mostly in its new structures, by using the incident management system in responding to this crisis. We welcome the draft global implementation plan on the recommendations of the IHR Review Committee. It demonstrates strong WHO leadership and that it clearly prioritizes high vulnerability and low capacity countries. Furthermore, we appreciate that it aligns the global implementation plan and a future global strategic plan in order to reform, improve and set mechanisms to better organize public health, preparedness and response, particularly with the help of GORN. We look forward to receiving information on the planned mechanism which aims at strengthening GORN as a tool to engage member states' technical experts. The implementation plan establishes a strong link between the emergency program and IHR review recommendations. It underlines rightly the strong connection between IHR capacity building with health system strengthening. Moreover, it offers a wise way forward on its issue of benefit sharing, as well as on monitoring and evaluation. In this respect, we welcome WHO's efforts in establishing the joint external evaluation process. But we still need more clarification on the actual implementation of external evaluation and the recommendations, with a focus on identifying the role that WHO headquarters, WHO country offices, member states and other actors play in the corresponding activities. We especially appreciate WHO's planned work to enhance compliance with temporary recommendations under the IHR. However, further elaboration is needed on the announced mechanism to monitor non-compliance and the intended standard operation procedures for escalating such cases of non-compliance. We welcome the establishment of the Scientific Advisory Group to help guide the WHO's work in evaluating and managing public health risks. We request more information to how it relates to existing advisory and oversight groups, and request information on the process of selection of the members of this advisory group. In general, when elaborating the global implementation plan further for the consideration of the EB, we suggest to make it more concrete, action-oriented, with timelines and responsibilities for Member States and WHO. The plan could encourage stronger national ownership by advising to link the national action plans to the national health strategies and health system strengthening. The upcoming recommendations of the High-Level Commission on Health, Employment and Economic Growth could be useful in that regard. Stronger emphasis should be put on education and training of national IHR focal points by using innovative approaches and tools such as e-learning platforms, real-time exercises, including multi-country activities. Finally, in the light of the significant budget increase of the programme, we expect a very clear and ambitious definition of outputs to be delivered by WHO in return. The EU and its member states stand ready to cooperate closely with WHO on this endeavour.
Merci la Slovaquie qui s'exprimait.
Thank you, Slovakia. Slovakia was speaking on behalf of the EU.
Je passe maintenant la parole à la Serbie et la déléguée de la Serbie.
I now give the floor to Serbia. You have the floor.
Thank you, Mr. President, Madam Director General, Madam Regional Director, distinguished delegates, ladies and gentlemen. Serbian delegation would like to complement the efforts made by WHO to reform its work on emergencies, and would like to underline in particular the importance of the country health emergency preparedness area of work. After the devastating floods that affected our region in 2014, we have put considerable effort in strengthening the preparedness for emergencies in the health sector in Serbia. In this context, the regional office has conducted numerous missions with the help of the country office in Serbia to support our efforts, providing technical advice. In particular, the work that was done to develop the National Health Sector Emergency Response Plan that incorporates all aspects of a fully operational incident management system will efficiently contribute to reduce mortality and morbidity during future crises, and also enhance resilience of the health system and in main institutions of the health sector, following an all-hazardous approach. This may serve as a model for other countries in the region on how to strengthen country capacities and the health system for all hazards health emergency risk management, and make the response to future emergencies more predictable. I would also like to add that events like the informal consultations organized on Sunday are very welcome and useful to receive updates on activities carried out by the WHO Regional Office for Europe in the context of emergency preparedness and response. We are looking forward to continue this important collaboration with WHO in the coming years in preparedness and response to emergencies. Thank you.
Merci beaucoup, Madame. Je passe maintenant la
Thank
parole
you
à la
very
Norvège,
much,
qui sera
Madam.
suivie par
Norway,
l'Italie.
to be followed by Italy. Norway, please.
Thank you, Chair.
First, Norway welcomes the report on the health emergencies program. It provides a good overview of progress made since the Assembly in May. Overall, WHO seems to be making good progress in rolling out the program. But, as stated earlier this morning, we are deeply concerned that financing for this area in the program budget at this stage is trailing behind. We would request the regional director to revert with a report to the RC in 2017 covering the program's first year of operation in the regional office. The global community has high expectations to the reform of WHO and the performance of the program. We therefore welcome the establishment of the Global Health Emergencies Task Force. We are also supporting it financially and hope it will be instrumental in implementing the recommendations of the high-level panel. We look forward to receiving the report from this task force and the Independent Oversight Advisory Committee at the Executive Board meeting in January 2017. We expect strong working relationships to be formed between the global and regional level and between programs, and are therefore encouraged that a program of cultural change has been initiated. Norway supports the integration of IHR capacity strengthening in the framework of an overall health system strengthening and a joint program of work in this area. We would also like to express our full support for the draft Global Implementation Plan for the recommendations of the IHR Review Committee. The draft is well balanced in terms of respecting existing provisions of the IHR. Establishing a scientific advisory group of experts will improve the overall work on IHR implementation and management of disease outbreaks. Norway sees the need for both increased implementation of the IHR as well as stronger monitoring of the work on IHR implementation in member states. We support the proposal of prioritizing member states with high risk and low capacity, as well as the joint external evaluations. The suggestions on the sharing of scientific information and the establishment of a risk evaluation and risk communications tool are good, as well as the proposals on enhancing compliance to temporary recommendations. Lastly, Chair, Norway supports the development of standard operating procedures for the focal points. Focal points should be empowered where necessary in order to carry out their functions as intended in the regulations. Thank you.
Merci. Je passe la parole maintenant à l'Italie, qui sera suivie du Turkménistan.
Italy, to be followed by Turkmenistan.
Thank you, Chair. Director General, Regional Director, Chair, thank you very much. We align with the Slovak declaration on behalf of the European Union and Member States. We